Today I'm doing it on case letter C, Mr. C, but I'm just going to call him James or Jimmy. All right. Hello, James. My name is Tyler. I'm a student of physical therapy under the direction of Dr. Sykes. And so it looks like you're coming in today. You got some neck. You're having something for your neck and then something for your low back, it looks like. And so we're just going to be doing some testing today, checking, how you're moving, how your neck's moving, how your back's moving, and then kind of testing some of the muscles in that area. In order to do that, I'm going to have to place my hands on your face, neck, and then kind of like your low back region. Is that something that is okay with you?
Sounds fine to me.
And then one of the tests that I'm going to perform, I'm going to have to ask you to take your shirt off. Is that something that's okay?
Meet up.
All right. So the first thing I'm going to start with, if you could take off your hat, please, it's going to be testing cervical rotation here. So the first thing I want you to do is just try to put your nose as far over your right shoulder as possible. And then I'm just going to put some pressure here. Are you having any pain with that?
No.
All right. And then if you could relax and come back to normal, and then do that again. Perfect. I got about 0 degrees to 63 degrees of right active cervical rotation. Normal is anywhere from 0 degrees, and then you want to get to 65 to 70 degrees. And then I'm just going to test bilateral. So if you could rotate to your left. All right. And then any pain?
No.
All right. Then come back to normal, and then rotate to your left again. All right. And then on that one, I got 74 degrees of left cervical rotation. 0 degrees to 74 degrees if you must. And if you would stand up, please. And so this is the one I'm going to have to ask for you to remove your shirt. And so now I'm measuring lumbar flexion. And so for this one, I just want you to bend over and try to touch your toes. And it's okay if you bend your knees a little bit. All right, I'm just going to apply some pressure here. Any pain?
No.
All right, and then stand up. And so for the sake of the test, I have a mark at the S2 level and then a mark 15 centimeters up. And so I'm just going to have you repeat that motion. All right, and then relax. And so I measured 22 centimeters, so 22 minus 15 is 7 centimeters. If I was using an inclinometer, the normal range would be you want to get to 50 degrees and between 50 degrees and 60 degrees. And so for this next test, I'm just going to move this table out. You can put your shirt back on if you like. And then when you're ready, you can put your head on this end of the table. And then if you could take off your hat and just hold it for now. And so the first thing I'm going to test here is going to be cervical rotation. And so in order to do that, I'm just going to place my hands on the side of your head. Is that okay?
Yeah.
And so what I want you to do is just rotate and try to put your nose just looking over your right shoulder again. Okay? And so for this, I'm just going to place my hands on his head. Is that hand placement uncomfortable at all?
No.
All right, and what I'm going to have you do, I'm going to apply a little resistance, and you're going to try to put your head and look back to normal. All right. And then any pain with that?
No.
And so with that, that's a make test, not a break test. That's why I'm not, forcing him and yelling at him to hold that position. It's because he's trying to return to neutral. And so some of the muscles with that are your scalenes, your SCM, your trap, and really any of those deep neck muscles, mainly unilaterally. And so for this last test, we're going to do trunk flexion. And so I'm going to ask you to put your heels, both heels, on the table, please. And what I'm going to do, I'm going to support your legs. And then what you're going to do, you're going to try to perform a sit-up, kind of like a modified sit-up, with your hands on the side of your head. And you're just going to try to clear as much of your back as possible. Okay? All right, so I'm just going to hold you here, and then whenever you're ready. All right, and then relax. And so seeing that he was able to keep his hands on the side of his head and clear his scapulus, that's a 5 out of 5. If he wasn't able to do that, I'd have him place his hands across his chest. 3 out of 5, I'd have him have his arms at the table, but not touching the table. And then after that, I'd have to palpate for rectus activity, because rectus is one of the big muscles here that's working. And rectus goes from your pubis to your ribs 5 through 7, and attaches to your sternum. Did you have any pain with any of that?
No.
All right. Well, thank you for coming in today.